Hi there, my name is Damir Barlas, and this is my presentation on Generalized Anxiety Disorder, or GAD. GAD is the acronym for Generalized Anxiety Disorder. GAD is a common form of mental illness. As its name suggests, GAD is characterized by anxiety. However, by anxiety that is more general than specific. GAD has a number of diagnostic factors that are discussed in detail after the case summary. Andrew M. is a 48-year-old white married male working as an accountant. For 7 months, he and his wife have been undergoing marital problems, culminating in the decision to divorce eventually, not right now. He often sleeps 2 to 3 hours a night, has intrusive thoughts about his wife, Lisa A., having sex with other men, and also has intrusive thoughts about checking Lisa's emails and phone to see what she is doing. He is so anxious that he routinely forgets client appointments, cannot work for more than 30 minutes without having intrusive anxious thoughts, and is almost always on edge. Andrew describes himself as having no friends, no close family, no organizational memberships, no church, and no community. His relationship with his wife is his only relationship. He has a self described coffee addiction and eats a fairly unhealthy diet. He is also overweight. The elements of the DSM GAD diagnosis are presented here. Andrew has experienced GAD for every day of the week for more than enough months, 7, to justify his GAD diagnosis. He can't control his thoughts, which run away from him. He has 3 symptoms: restlessness, difficulty concentrating, and sleep disturbance from the list. His symptoms aren't better explained by another disorder. His impairment has reduced his ability to work, and his coffee use or other substance use does not explain the diagnosis. Therefore, GAD is justified. In the intrapersonal scheme, Andrew has high intelligence, but his bad diet and coffee consumption are intrapersonal stressors. There is evidence that caffeine can increase anxiety, particularly among men who have certain metabolic traits. Alice Murray, 2020. Also, his bad diet is simultaneously a mark of low self-care and a deficit in terms of supporting his emotional health. A diet high in fat, sugar, and calories can raise anxiety, according to Bear et al., 2020. Interpersonally, Andrew has many interpersonal deficits. He has no friends or social circle. He doesn't belong to organizations, churches, or committees. Because his social life is underdeveloped, he lacks important resources that can support him during and after his therapy. These deficits should definitely be talked about in therapy itself. As noted in the case study, Andrew is not surrounded by community. His isolation is clinically important because isolation has been found to be an exacerbating factor in both anxiety and depression. Therefore, Andrew's isolation will have to be addressed for his long-term healing to be facilitated. In the spiritual term, Andrew is an atheist. His atheism is important to his treatment in the sense that Andrew does not have a larger meaning-making structure that can be assistive in the context of anxiety management. Andrew lacks an external point of reference that can confer meaning on a self-described struggle with anxiety, which he views as random. Feeling oneself to be the victim of random bad luck can make depression and anxiety worse, according to Swan and Halberstadt, 2020. The genetic causes of GAD, of anxiety, this slide lists several genes that have been implicated in anxiety, according to Fairweather, Schmidt, and Wade, 2020. Mutations in these genes, either in single genes or in combinations, can make it easier for people to feel anxious, even in the absence of obvious stressors. In the diathesis stress model of mental illness, someone who is genetically susceptible expresses a pathology when they are under sufficient stress. Andrew might have genetic factors that rendered him vulnerable to GAD in the presence of his current marital stress. There are also environmental causes in anxiety. In the diathesis stress model, environmental causes might not bring about anxiety from scratch. Rather, environmental causes trigger anxiety in someone who is already genetically predisposed to anxiety. In Andrew's case, the main environmental cause is the deterioration of his marriage. In a CBT approach to individual therapy, Andrew could be treated by retraining his thinking. The contents of Andrew's thoughts could be challenged, and in this process, the feelings arising from these thoughts can also be circumvented. For example, Andrew genuinely believes that the ending of marriage would be, quote, the end of my world. This cognition can be challenged by asking Andrew to consider how other people survive divorce and how he himself has survived past relationship breakups. In exposure therapy, Andrew could be asked to envision what it is like to be divorced until this state is no longer as fearful to him. Andrew's wife is preparing to file for divorce, therefore, it might be more appropriate to suggest couples counseling that is essentially divorce counseling rather than marriage counseling. The difference between these two forms of counseling is that divorce counseling is more oriented to helping a divorcing couple navigate life before and after the divorce, which is where it looks as if this relationship is heading. There are several medications that can assist with anxiety. SSRIs reduce symptoms by acting on the hormone serotonin. It is also possible for antidepressants to help with anxiety. Finally, anxiolytics help to facilitate a physical relaxation that is also accompanied by sleep. Because Andrew reports a very low quantity and quality of sleep, anxiolytics could combine sleep promotion with direct anxiety reduction. One of the ethical issues involved in treating anxiety is symptom exacerbation, which can take place with exposure therapy and CBT, according to Brown et al. 2019. Because Andrew is already a catastrophic thinker, discussing certain things with him in therapy could make him feel worse before he feels better. If Andrew drops out before the therapy has a chance to stabilize him, there is a chance that he will get worse. The therapist will not be able to prescribe, and given that pharmaceuticals are either already being applied in Andrew's case or are likely to be utilized, the therapist needs to be in contact with the psychiatrist. The therapist should learn which medicines Andrew is currently taking, what their effects are, and how they might impact the course of therapy. There are some important self-care issues that arise in the diagnosis and treatment of GAD. One such issue is the need for calming and normalization. Andrew does not currently have a self-care outlet that can relieve some of his anxiety. The therapist should discuss such an outlet with him. Also, anxiety can cause a decline in other aspects of self-care, such as hygiene. Thank you for listening.